Hi guys, this is your Dr. Christopher Macario, and this is an explainer video on cardiovascular agents. So, just a quick overview. Itong cardiovascular agents, kung titignan natin, it targets three things. Kasi pag pinag-usapan natin yung uh, cardiovascular agents, number one, we tackle about the heart, yung cardiovascular organ natin. Number two, it also targets yung blood vessels. If you remember yung tatlo na yan, you have your yung veins, arteries, okay? And of course, it also targets the blood, okay? At the end of the discussion, you should be able to understand cardiovascular drug and its subclassifications and differentiate the actions of cardiac glycosides, anti-anginals, and antiarrhythmic drugs and other subclassifications of cardiac drugs. Okay, cardiovascular drugs include number one, you have your cardiac glycosides, your anti-anginals, which is subdivided into your dilators, or otherwise termed as your nitrates. You have your beta blockers, calcium channel blockers, and number three, you have your antidysrhythmic drugs, which include your sodium channel blockers, beta blockers, drugs that prolong repolarization. Remember, we're talking about muscles. You have your calcium channel blockers. Okay. As for your anti-anginal drugs, they are used to treat angina pectoris, a condition of acute cardiac pain caused by inadequate blood to flow to the myocardium due to either plaque occlusion within or spasms of the coronary artery. Decreased blood flow to the myocardium results in pain, and anginal attacks may lead to MI, or otherwise termed as your myocardial infarction, or in layman's term, your heart attack. Anti-anginal drugs include your nitrates or dilators, your beta blockers, and your calcium channel blockers. For antidysrhythmic drugs, you have your cardiac dysrhythmias, or otherwise termed as your arrhythmia. It is any deviation from the normal rate or pattern of your heartbeat. This includes heart rate which is too fast, or otherwise termed as tachy or tachycardia, too slow, pwedeng sabihin na brady or bradycardia, or irregular heartbeats. Cardiac dysrhythmias or dysrhythmias often follow after a heart attack. Antidysrhythmics also include your sodium channel blockers, beta blockers, drug that prolong repolarization, and calcium channel blockers. So, ang dami-daming cardiac drugs na kailangan i-memorize. Okay? So, just to be sure, okay, may ginawa si Sir na mnemonics na pwede nating matandaan so as to remember all those cardiac drugs. Para hindi ka malito when it comes to cardiac drugs, let's break it down into the following. A, B, C, D, D, D. A stands for ACE and ARBs, which lowers the blood pressure. B stands for beta blockers, which lowers the heart rate and BP. C stands for calcium channel blockers that lowers the heart rate and the BP. And the DDD stands for digoxin, dilator, and diuretics. Digoxin lowers the heart rate but not the blood pressure, as you can see. Dilator, from the word itself, dilator or nitrate, which dilates the capillaries, pwedeng sa capillaries, okay, or yung sinasabi nating peripheries natin. Okay, and you have your diuretic, which we have already discussed, which promotes diuresis, and its effect lowers the blood pressure. Let's talk about ACE and ARBs. So, what do they stand for? A stands for angiotensin converting enzyme inhibitors, or ACE. When ACE is inhibited, it inhibits the formation of angiotensin 2. So, ibig sabihin yan means it causes vasoconstriction, or it's a vasoconstrictor, and it blocks the release of aldosterone. Ano yung ginagawa ngayon ng aldosterone? When aldosterone is blocked, sodium is excreted along with water, and potassium is retained. And sabi nga natin, wherever sodium goes, water follows. So meaning, pagka na-block yung aldosterone, so lumalabas din yung sodium. Okay? ARBs stands for angiotensin 2 receptor blockers, or ARBs as we call it. ARBs is similar to ACE inhibitors because they also prevent the release of aldosterone, a sodium retaining hormone. ARBs is different from ACE because ARBs block angiotensin 2 from angiotensin 1 receptors in the tissues. ACE and ARBs cause vasodilation and lowers the peripheral resistance, or in short, it brings down your blood pressure. To remember ACE and ARBs, remember AAA. ACE and ARBs act to lower blood pressure only, not the heart rate. ACE is the first choice and ends in PRIL. Okay? It's called the chill pill for the heart by decreasing peripheral pressure, or decreases blood pressure but not the heart rate. It spares potassium and causes angioedema, or swelling of the face and tongue that may cause airway risk. Lalong-lalo na kapag yung tongue nag-swell. Okay? And the other A stands for your ARBs. It's the second choice. Angiotensin receiver blockers, and usually ends in sartan. For example, losartan or relax man. Yung relax man, ano lang to? Para matandaan mo na yung ginagawa niya is nire-relax niya yung heart. Okay? It lowers the blood pressure and not the HR. And it also spares potassium. Okay, quick question. Do we give ACE and ARBs if the heart rate is below 60 beats per minute, or there is bradycardia? Quick question. A quick answer is yes. ACE and ARBs act by lowering peripheral pressure, or BP, only, and not the heart rate. So we only hold for a low blood pressure less than 100 systolic. Okay? The mechanism of actions of both ACE and ARBs is that they inhibit the RAAS system, or the renin-angiotensin aldosterone system, which retains fluid. Kasi nga, yun yung ini-inhibit natin. So, tinatanggal yung sodium. Okay? Just remember, ACE and ARBs precaution is AACE, avoid pregnant, because ACE and ARBs are baby toxic. Remember, there is angioedema. So, pagka merong angioedema, it's a risk for airway. So, check your patients. Okay? Cough is, it's normal, but it's only for ACE and an elevated potassium. Bakit? Okay? Kasi nga, itong ACE and ARBs, yung potassium, they save it. And so, an elevated potassium means that merong hyperkalemia, or meaning a potassium level of more than 5.0. And remember, we are talking about the heart. So, yung common signs usually kapag ka merong mataas or mababang potassium can be seen in muscles, specifically yung heart muscles, yung sinasabi nating spasms. Okay? And remember, it's baby toxic. What do you tell your patients? As nurses, you're responsible to give the health teaching about number one, tell patient to avoid potassium-rich foods like fruits, green leafy veggies, avocados, melons, oranges, and others. Kasi yung mga green leafy vegetables na yan, eh, mataas sila sa potassium. And since A's and ARBs, they save potassium or okay? So, ibig sabihin, magkakaroon tayo ng risk yung patient natin ng sinasabi nating hyperkalemia or a potassium level that's above 5.0. Since potassium pumps muscles, watch out for early signs of hyperkalemia or a value of uh, something that is greater than 5 or high pumps of muscle or muscle spasm. Any potassium imbalance, whether it's high or low, the first action of the nurse should be to hook the patient to a cardiac monitor. Okay, remember ACE and ARBs, or which drugs that end in prils and sartans. Remember the AAA. A for antihypertensive. Ano ibig sabihin yan? It lowers the blood pressure but not the heart rate. So remember that, huh? It's so meaning slow patient movement. Bakit? Kasi nga usually kapag ka antihypertensive, ano ba yung ibig sabihin nito? So bumababa nga yung BP. So what happens? Nagkakaroon sila sometimes yung sinasabi nating orthostatic effect. Orthostatic effect kasi nga bumaba yung BP, usually nagkakaroon sila ng yung nahihilo sila. And so, you have to tell the patient, dahan-dahan lang po sa paggalaw kasi baka himatayin sila because of the decreased blood pressure. A, avoid for pregnant, meaning it's not baby safe, and it adds potassium. So there is a risk for hyperkalemia, meaning a potassium level of more than 5.0. And you have to remember this first dose phenomenon. When giving the first dose, nurses should not leave the bedside to assess big side effects. Ano yung side effect na yan? A big drop in the blood pressure or yung sinasabi nating hypotension. Although yung gusto natin in general is bumaba yung blood pressure, yes. But you have to think of an airplane. Bakit? Pagka yung airplane naglaland, ang gusto natin dahan-dahan. Hindi yung from mataas biglang bababa. Okay? That's very uncomfortable. And that is the same for our patients. Ganun yung gusto nating effect, yung pagbaba ng blood pressure dahan-dahan. Okay? Kasi hihimatayin, mag-faint yung patient natin if there is a big drop for the shortest time. Pag masyadong mabilis, okay, yung pagbaba ng blood pressure. So, think of an airplane landing. Dahan-dahan lang dapat yung pagbaba ng blood pressure. The next one is your beta blockers. So, tapos na tayo sa ACE and ARBs. It's time for B or beta blockers. So, beta blockers block the beta 1 and beta 2 receptor sites. Beta blockers decrease the effect of your sympathetic nervous system by decreasing the heart rate and the blood pressure or the peripheral resistance. Think of it as it's the one putting the brake on the heart or blocks the beats. Beta blockers usually end with LOL or LOL. Example, metoprolol or atenolol, which lowers the heart rate and the blood pressure. Nurses should always check the heart rate and BP before giving beta blockers to patient. I will repeat. Nurses should always check the heart rate and the BP before giving your beta blockers to your patients. Why? Because it includes the three negative tropic effects. The first one is its negative chronotropic or negative chrono because it lowers the heart rate. Negative inotropic or negative ino means it lessens the force of the heart or it relaxes the heart. And the negative dromotropic or negative dromo, meaning it lessens the heartbeat. So ano ibig sabihin yan? Decrease heart conduction that result in less heartbeats. And negative tropic simply means decrease in resistance. So pagka yung resistance, anong nangyayari? Bumababa yung heart rate. Negative inotropic or yung less force. Anong ginagawa niya? Okay, pinabababa niya yung workload of the heart and so it relaxes the heart. Kasi nga kapag may problema sa heart, okay, bumibilis yung heartbeat natin. And by decreasing or lessening the force or contraction of the heart, okay, so nare-relax natin yung heart. And of course, with negative dromotropic or lessens the heartbeat, okay, yung yung cardiac output natin is improved. Okay, kasi nga bumabagal yung heartbeat natin. Okay, beta 1 and beta 2. Beta 1 blocks the receptors in the heart while the beta 2 are the receptors in the lung. So ano bang ginagawa nitong drug nito? Number 1, it blocks the sympathetic nervous system. If you can recall, ito yung sympathetic nervous system, okay? Ito yung nagtitrigger ng fight or flight. So ano ginagawa niya? Okay, yung sinasabi niya kapag may fire, nabubuhat mo yung aparador or yung cabinet. So, yung mga ganyan, ano ba yung effect niyan sa system natin? Well, the systemic effect of your sympathetic nervous system to the body is it increases heart rate. Kasi nga, fight or flight Either labanan mo yung stimuli or tumakbo ka. Either way, lumalakas ka, bumibilis yung heartbeat mo, yung respiratory system, bumibilis din. Okay, it dries your mouth. It puts the GI system in sleep mode. Okay? Kasi hindi mo nga daw siya gagamitin. Ina-activate niya yung respiratory system, cardiovascular system, pinabibilis niya mga yan. Yung muscular system, di ba? And yung sensory system mo nagiging nagiging sensitive. So, yun yung sympathetic nervous system. This drug blocks that effect. Okay? Yung effect in the heart, yung sinasabi nating beta 1 effect. So, kung yung sa sympathetic nervous system bumibilis kasi it prepares more output, pinababagal ngayon nitong drug na to, itong beta blockers. Okay? Most drugs are non-selective or has systemic effect which results to vasoconstriction of the heart. Kaya ngayon yung sinasabi natin na good effect. And at the same time, kasi nga systemic effect, it also narrows or constricts the lungs respiratory pathway. Ito yung bad effect. Or narrows the bronchi which in turn nagkakaroon ng sinasabi nating bronchial spasm. And because of its effect na nagna-narrow, okay, nagna-narrow yung bronchi natin, it is the reason why we do not give that to COPD patients. Bakit? Kasi nga, yung COPD patients, yun mismo yung problema. Narrowed bronchi or meron silang bronchial spasm. And by giving this medication, we worsen the COPD. The dangerous side effects include, remember this, BBBB or 4Bs. Number one, bradycardia and low BP. If, okay, hold the drug if the heart rate is less than 60 beats per minute, or if the blood pressure is less than 100 systole. Ulitin ni sir. Hold the drug or do not give the drug if the heart rate is less than 60 beats per minute, or if the BP is less than 100 systole. Remember the effects. Pinapababa niya yung blood pressure and pinapababa niya rin yung heart rate. And by giving the medication with the following conditions, masyadong bababa yung heart rate and yung blood pressure natin. We do not want that. We want those values amounting to the normal level. And because of those, we also teach our patient about slow position changes. Bakit? Kasi nga bumababa yung blood pressure natin. And what does it mean? The patient experiences, yung sinasabi nating nahihilo sila. Normal yun kapag bumababa yung BP. And so we advise them, slow position change. Mabagal lang yung paggalaw kasi baka himatayin sila. Or if possible, sana may nag-a-assist sa kanila na relative. Okay? Breathing problems. Beta blockers block beta 2 in the lungs that result to bronchospasm or wheezing. Nagkakaroon ng narrowed airway. Bakit? Kasi nga itong drug na to, non-selective, meaning yung effect niya sa heart maganda. However, there are side effects that needs to be monitored. And because of the bronchospasm and the wheezing, we do not give this drug to COPD patients because it will worsen the COPD. Another B, it's bad for heart failure patients. Why? It can worsen the condition of heart failure patients because it may cause edema, crackles, rapid weight gain, which indicate fluid retention. All those things, yung edema, crackles, rapid weight gain, and fluid retention, meaning, ano ginagawa niyan sa heart natin? Okay? Kapag ka merong fluid retention, okay, itong mga crackles na to, meaning may fluid tayo sa katawan eh. Ano ibig sabihin yan? Well, for one, ang gusto nga natin bumaba yung blood pressure. But pagka may fluid accumulation in the body, yung heart natin nagdodoble sa pag-work. Kasi sinicirculate niya yung fluid eh. Eh di ba nga kaya nga natin pinabababa yung fluid sa katawan para ma-relax yung heart. Okay, so main word, relax the heart. Okay, and another B is blood sugar masking in diabetic patients. Beta blockers hide signs of hypoglycemia. Now, yung sinasabi nating normal blood glucose natin is 80 to 120 milligrams per DL. In some books, it's yung range niya is 70 to 110. But for uniformity's sake, yung gamitin na lang natin is 80 to 120 milligrams. Okay? So, it hides shaking, cool, clammy skin, and high fever. And so, as nurses, we have to monitor the blood sugar closely when we give this drug. Okay? So, remember, low blood sugar means low brain function. Or, pwede rin tandaan mo, hypogly or the brain might die. Okay, let's move on to C or calcium channel blockers. So, first let's talk about calcium. Calcium activates myocardial contraction, increasing the workload of the heart and the need for O2. Okay, kung mapapansin mo, okay, yung sodium, yung potassium, and this time around, yung electrolyte na calcium is, ang ginagawa natin, binablock natin yung tatlo na yan. And the effect is that it relaxes the heart. Okay? So, calcium channel blockers, in general, lowers the heart rate and the blood pressure. It blocks the movement of calcium inside the cell, which relaxes vascular smooth muscles that result to decreased vascular resistance and cardiac contractility. With all that jabber, ang ibig lang sabihin yan is it reduces the workload of the heart, which is good kasi nga nare-relax yung heart. And by doing so, okay, um, it takes the strain of the heart. Yung pagod niya nawawala. Okay? It simply means that calcium channel blockers relaxes vascular smooth muscles, yung puso mo, yung heart, okay, which takes the strain off the heart or calms the heart. These calcium channel blockers end in dipine or zem or mil. Example, nifedipine. Okay? Calcium CB also includes the three negative tropic effects. Ano yun? Negative chrono, meaning it lowers the heart rate. Negative ino or inotropic, it relaxes the heart. And negative dromo or dromotropic decreases the heart conduction that result in less heartbeat. The three negative tropic simply means decrease in resistance. So pag mababa yung resistance, nare-relax yung heart. Decreased workload and cardiac output. The side effects include your headache, hypotension, dizziness, flushing of the skin or yung pamumula ng skin. You have your tachycardia. Peripheral edema may occur and changes in kidney and liver function, so serum enzymes should be checked by nurses. Key nursing considerations, remember CCB. Count heart rate and BP before giving this medication. Change position slowly. Remember the orthostatic effect. Remember, it brings down your blood pressure. So you have to watch out for fall. So slow position changes and bad headaches. Pag sinabi sa'yo ng patient mo, ang sakit ng ulo ko, tell the patient that it's quite normal at mawawala rin siya. When to hold beta blockers? Number one, the heart rate is below 60 beats per minute or the BP is below 100 systole. Bakit? Kasi nga kung ito yung makukuha natin, 60 beats per minute or mas mababa pa, or a BP with 100 systole or mas mababa pa, when we give the medication, bababa pa lalo itong mga digits na to, which is bad for the patient. Okay? Avoid big drops in BP. Remember, pinag-usapan natin yung airplane. Ang gusto natin, gradual yung pagbaba ng BP. Hindi mabilis. Just like the airplane. Letter D stands for digoxin or cardiac glycoside. Digoxin is the medication while cardiac glycoside is the class. Now, cardiac glycoside inhibit the sodium-potassium pump, which result in an increase in intracellular sodium that result to increase in calcium, which causes cardiac muscles to contract more efficiently. Simply put, cardiac glycoside or yung gamot na sinasabi natin na digoxin allows the heart to have deep contraction that result to a more forceful contraction. In short, kung yung heart natin, kasi nga may problema sa heart or yung sa pagbibigay ng blood, so if the heart, yung tibok niya mabilis like labdab 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 labdab, yung ginagawa ng cardiac glycoside or digoxin is ini-improve niya ngayon yung heartbeat, pinababagal niya, and yung cardiac output na i-improve. So kung labdab 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 labdab, yung cardiac output medyo hindi siya maganda, very little, konti. And on the side, nasistrain pa yung puso kasi mas mabilis nga siyang gumagalaw, mas mabilis nagko-contract. So, yung ginagawa ng digoxin, okay, from labdab, 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 yung heart natin, nare-relax. So, ang ginagawa niya, labdab, labdab, labdab. Ano ginagawa niya? Mas bumabagal yung heartbeat natin, and on top of that, gumaganda yung cardiac output natin. Is that good? Yes. Why? Kasi nga, the better the cardiac output, mas na-oxygenate yung katawan natin. Meaning, mas maganda yung circulation ng blood all over the body. And that's what digoxin does to the body, to the heart. It decreases your heart rate or negative dromotropic, meaning less beats. However, caution, digoxin is a very toxic substance or medication. Remember, digoxin is a toxin. Kaya yung nakikita mo dyan, if you watch yung Naruto, ito yung kalaban ni Naruto na meron siyang poison. Remember, digoxin is a poison. And remember ATP. Ano ba ibig sabihin yan? A for apical pulse. Check apical pulse for 60 seconds. And do not give if pulse rate is 60 beats per minute. Why? Kasi nga, one of the things this digoxin does is pinabababa niya yung heart rate. And if we do not hold the drug, kapag ka masyado nang mababa yung heart rate, it will fall, mas mababa pa siya, which is, we do not want that. Okay? Toxicity or T. The symptoms of toxicity include vision changes, nausea and vomiting, anorexia, dizziness, and lightheadedness. Vision changes may also include fuzziness, malabo or blurred vision, color changes, and difficulty reading. Anything more than 2.0 is toxic, and so notify the physician ASAP for signs of toxicity. Antidote for toxicity is digoxin immune, FAB. And so, para ma-check natin yung toxicity na yan, we have to check the labs or yung kidney labs. Ano yon? Number 1, you have your BUN. Second, yung creatinine is the number 1 kidney lab, and the normal creatinine value is 0.6 to 1.2. Creatinine value of over 1.3 means no PP or kidney injury. We have to monitor elderly and kidney failure patients, kasi nga yung kidney pwede natin siyang gawing, if sa loob ng katawan natin sila yung sinasabi nating pauso lang ni sir, yung washing machine. Nilalaban niya yung mga maduduming blood and tinatanggal niya yung mga waste products. And with the elderly and kidney failure patients, medyo mababa yung pagtanggal ng kidney or yung pag-function ng kidney, or sometimes nawawala yung ganong function ng kidney. Okay? P stands for potassium. Okay, so remember, we have to check potassium. Any value lower than 3.5 increases risk of toxicity. Okay, ano ba yung normal ulit ng potassium? The normal potassium level is 3.5 to 5.0. So, digoxin does not waste potassium. Okay, however, caution. Patients who are at risk for digoxin toxicity are patients on potassium wasting diuretics and kidney failure patients. Other signs of toxicity include your headache, malaise, and dysrhythmias. D for dilators or vasodilators or nitrates. So along the discussion, pwedeng mapagpalit sila, but you have to think na we are only referring to one. Okay? Dilators can be referred to as vasodilators or nitrates, and they are the first agents to relieve angina. Dilators cause a generalized vascular and coronary vasodilation, which increase blood flow to the coronary arteries going to the myocardial cells. So, from the word itself, vasodilation. Yung sinasabi kasi natin na myocardial cells, okay, sometimes the heart gets problems, lalong-lalo na kapag ka nakukulangan siya ng circulation. What is in circulation? Ano ba yung nandun sa blood? Oxygen, yung mga ganyan. And one of which, yung heart cells natin specifically, yung myocardium, ito yung part na nagpapatibok sa puso. It controls the electrical impulses in the heart. If you can still remember that. So, kapag ka naaapektuhan yung myocardium natin, meaning nagkakaroon ng problema yung heart kasi nga kulang ng oxygenation. And that's precisely what your dilators do. Ini-improve niya yung circulation sa heart para pagdating nga dun sa myocardium, yung requirement niya for circulation, yung oxygen requirement niya is met. It may be given to patients with chest pain. Pag sinabi nating chest pain, okay, sa yung mga lay people, chest pain. But for medical professionals, ang ibig sabihin ng chest pain is angina. So, meron kang maririnig sa ward, oh, may angina si ganito. Meaning, masakit yung chest niya or meron siyang chest pain. Okay? But this may also be given for heart failure to lower the blood pressure. So, yung common na binibigay natin for these types is yung gamot na nitroglycerin. As you can see dun sa picture, meron dalawang picture. Picture number A, yung hose. Picture number 3, yung hose na merong nakahawak dun sa pinakadulo niya. Okay? Sa picture B, so kapag ka walang medication, yung may nakahawak dun sa butas. So, yung tubig, medyo may pressure. Okay, that's what happens doon sa ano natin, sa mga peripheries natin, doon sa coronary arteries natin. Pwedeng because of fat or pwedeng matigas na lang yung peripheries, but in short, merong pressure, may nagbablock, kaya mataas yung pressure ng blood. Your dilator or vasodilator, ang ginagawa niya, nagkakaroon ng vasodilation doon sa peripheries. And so what happens? You have to refer to yung picture A. 'Di ba? Wala na yung kamay na naka-block. So meaning yung blood flow freely na, mas mabilis without pressure. And because of that, yung puso, yung heart, nare-relieve. Dilators open blood vessels too. Remember DDD. They decrease the blood pressure, dilate the vessels, and decrease vascular resistance. As with yung sa last slide, yung explanation is between the hose. Tapos merong nakabara na kamay dyan. Okay? It helps decrease the preload and afterload, which lowers the blood pressure. The top 5 vasodilators include yung number 1 dyan is your nitroglycerin, nitroprusside, hydrazine, and Caution, hindi siya diuretic. You have your isosorbide, that is a dilator, and your minoxidil. Addendum, a famous vasodilator is your nitroglycerine. Nitro makes the BP low and gives O2 to the heart muscles. Nitroglycerine is like a pillow for the heart because it helps it relax. And explain na ni Sir Yang kung bakit. When the heart is rested and relaxed, it results to low BP. Remember that. Nitroglycerine tablets decompose when exposed to light and heat, so they should be kept in their original airtight containers. Remember that. After a dose of nitroglycerine, patients may experience dizziness, faintness, or headache as a result of peripheral vasodilations. Pakitandaan yan. Other considerations are number one, no Viagra or those ending in a "-phil". Example, sildenafil because it will kill your patients. Dilator na nga yung bibigay mo tapos yung Viagra dilator din yun. Okay? Aatakihin sa puso patients mo. Stop if low BP, systolic below 100, or drops by 30 milligrams per HD systolic. Remember, ayaw natin ng masyadong mabilis yung pagbaba ng blood pressure. Yung gusto natin, parang airplane. Hindi masyadong mabilis yung pag-drop ng blood pressure. Remember, the normal side effects are HHH, headache, hypotension, and hot flushings. So diuretics is the other D. Hindi ko na i-discuss yan because we have already discussed that. Other cardiovascular drugs include your sodium channel blockers. They are antidysrhythmic and decrease sodium influx into the cardiac cells. You have your subgroups as class 1A or slow conduction and prolonged repolarization like your quinidine and your procanamide. 2-1B class or slow conduction and shortened repolarization, and an example would be your lidocaine. And last is drugs that prolong conduction. An example would be your flecainide. Drugs that prolong repolarization are used in emergency treatment of dysrhythmias. Amiodarone increases the refractory period or the recovery time and prolong the action of potential duration of your cardiac cell activities. If you refer to the picture, yung sodium and potassium pump. And yung meron naman parang dyan, yung depolarization, repolarization. Lahat naman ng muscles may ganyan, which ito, diniscuss na to sa human anatomy and physiology. Okay. Antihypertensive drugs. So, hypertension increases the blood pressure such that the systolic pressure is greater than 140 milligrams per mercury, and diastolic pressure is greater than 90 mmHg. Now, most common condition leading to MI or myocardial infarction, stroke, renal failure, and death is hypertension. Okay, dun sa picture sa baba, yung on the picture on the right, pwede natin i-compare yung blood vessels kapag kaganyan would be meron siyang hypertension. And on the left, on the left side, yung may hypertension, and on the right side, yung effects of your antihypertensive drugs. Okay, or your picture B. Antihypertensive drugs is used alone or in combination with other drugs to bring down BP. There are 6 categories. Number 1, you have your diuretics. 2, sympathetic depressants or sympatholytics, which are your beta blockers, centrally acting alpha 2 agonist, alpha adrenergic blockers, adrenergic neuron blockers or peripherally acting sympatholytic, alpha 1 and beta 2 adrenergic blockers. The third is your vasodilators or dilators. Fourth category is your ACE inhibitors. The fifth is your ARBs or your angiotensin receptor blockers and your calcium CB or your calcium channel blockers. Antihypertensive drugs that were not discussed in the cardiac drugs. These includes your centrally acting alpha 2 agonist, which decreases the sympathetic response from the brainstem to the peripheral vessels and decrease cardiac output by decreasing epinephrine, norepinephrine, and renin release. An example of those drugs include your methyldopa and clonidine. Methyldopa was one of the first drugs widely used to control hypertension and causes sodium and water retention, so it is frequently administered with diuretics. The side effects includes drowsiness, dry mouth, dizziness, and bradycardia. Must not be given to patients with impaired liver functions. Alpha adrenergic blockers includes those drugs that block the alpha adrenergic receptors, resulting in vasodilation and decreased BP by blocking the plaque buildup, or otherwise termed as your atherosclerosis in the arteries. It's safe for diabetic patients and does not affect the respiratory function. An example of these drugs are your prazosin, darazosin, and your doxazosine. Alpha 1 and beta 1 adrenergic blockers block alpha 1 and beta 1 receptors that include blocking alpha 1, which causes vasodilation and decreased BP. Blocking beta 1 causes decreased heart rate and contractility, giving the heart a rest. An example of which is your labetalol. And that's it. Thank you for listening. If you have any more questions, you may give me a message and chat. Thank you.